everyone, and thank you so much for joining us. This is going to be a great conversation talking about cross-border partnerships and cross-sector partnerships on infrastructure, talent development, and how health can actually drive economic growth and innovation in Africa and beyond. But Mr. Gates, Bill, we need to ask first about what's going on in the world right now. Now, you've pledged a lot of money, only yesterday, to step up the fight against diseases. You've asked governments to reverse global health funding cuts. What do these cuts mean for the world, and what do they mean for Africa?
Well, the last 25 years, the rich countries have devoted a bit less than 1% of their budget to all aid, including health, humanitarian relief. And unfortunately, those numbers are going down, from 1% down. And, you know, the impact of that money was to save tens of millions of lives. And so the obvious corollary is that this will be the first year in 25 years that more children will die than died the year before. We went from 10 million down to 5 million, and now we're headed in the other direction because of the aid cuts and because of the debt situation that many of the key countries, particularly in Africa, find themselves in.
And private money can't make up for any of that.
Well, private money, I mean, there's philanthropy, which is tiny compared to the government money. You know, overall assistance, that 1% was like 220 billion. And very, very few philanthropists give money in Africa. So it's not, you know, 5% of the cuts. The cuts alone overwhelm the philanthropic piece.
I'll get to Masai in a second, but why are you focusing on Africa, actually?
Well, it's where, you know, it's sort of the golden rule, help those who need it the most. In Asia, we've had a lot of the big countries that got help with vaccines and medicine, Global Fund and Gavi. Countries like India, Indonesia, Vietnam, they were able to develop their economies enough that they graduated from being an aid recipient. So in Asia, we have two big countries, Pakistan and Bangladesh, and a few tough countries, Afghanistan and Yemen. But by and large, we have a lot fewer people who are in need of foreign aid. In sub-Saharan Africa, although the potential in the 10 to 20-year time frame is very exciting, which we'll talk about, they are not anywhere near the threshold to get out of the poverty trap in terms of nutrition and primary health care and vaccines, the very basic stuff. And so their big asset, which is their young people, because if you don't take care of the health care thing, not only do you have a high rate of death, but you have a high rate of people who are never able to physically and mentally develop because of malnutrition. So a little bit, it's the magic formula has been the generosity, innovative new tools to unlock all of this human potential where, you know, Africa's the young continent. It's the only continent where you have population growth. And, you know, so, you know, will that youth bulge be an asset or not is what's in the balance.
Masai, you're a UN Sustainable Goals Development advocate. Do you see meaningful change?
I do. I think, first of all, incredible work. Bill, I was at your event a couple days ago, and we spoke. But what you're doing on the continent is incredible for us. I think we can't really focus on the crisis. We have to look ahead now. There is, if aid or whatever has been cut from going to Africa, I thought the way it was done, it could have been done over time, which would have meant more to Africans, in my opinion. And we have to also take responsibility. We have to invest in the people, youth of Africa. Africa's biggest jewel is its people. Yes, and we have to really invest in this and take our time. I think mental wellness and health is something that we really need to talk about with the youth now. I think investing in infrastructure is really big in our continent, and we have to really pay attention to this. But the youth and the population, we, all of us, have to pay attention, especially Africans.
Talk to me about sports. So what role does sports play into this? I mean, this is what you do.
Well, if I tell the crowd this, I love Bill, I love you. If there was a match right now, Nigeria playing versus USA, or the Lakers were playing in the finals, nobody would be listening to us speak right here. They would be watching the game in another room. Yes.
Bill, come on, fight back.
That's what sports does. And sports brings people together. Health, education, those things are human. They are the most important things in the world. There's no question about it. But what sports does, it brings peace. If you bring a ball, it unites people in an incredible way. And we in Africa, we do a great job with competition. We do a great job with recreation. We haven't done much with mental health and sports. And we don't see sports as a business. Yes, we see it as recreation and we see it as competition. We need to open our eyes and build infrastructure and see sports as a business, because we have the talent, we have the artists, we have the athletes. It's incredible.
I want to show some pictures, Masai,
Yes.
of your pretty incredible multi-million sports complex in Rwanda. Now, it's a hotel, an arena, a gym, a playground, a sports bar. What were some of the challenges in putting that together?
So I think President Kagame has done an incredible job in being a visionary. He came to the All-Star game in 2016 and he built that arena in Kigali. He redid the stadium in Kigali, and you have to build the ecosystem that builds sports. That's what Madison Square Garden is. That's what Scotiabank is. That's what crypto is. How do you commercialize? And that's what we did in Kigali. You see the hotel, you see the sports bar, you see the restaurants, you see the shops where people can buy merchandise, they can go to games. You see the incredible stadium, the arena he built in Rwanda. Now, what can we do? Kenya, what can we do in Nairobi? What can we do in Lagos? What can we do in Johannesburg? All these cities don't have an arena.
Amazing. I mean, the pictures say it all. Bill, you said you're directing a lot of your money, right, towards Africa for health and development. How are you partnering with governments to get it done and also to make sure what the priorities are?
Well, the top priority for any government is stability in health and education. Rwanda's done a lot of very good things. As a percentage of sub-Saharan Africa, it's not that high, but a lot of the best practices now are coming out of Rwanda, which surprises people. In East Africa, if Kenya can take care of their debt structure, which is pretty tough for them, that whole East Africa area, there's a lot of promise. Ethiopia's doing a lot of good things. The most critical country for the future of sub-Saharan Africa is Nigeria.
Yes, sir.
And there's a lot of things great about Nigeria, and there's a lot of things that are very tough, including politics, in Nigeria. And I have a good friend, someone we both know well, Aliko Dangote, who's getting involved in philanthropy as he's had incredible business success. So that's a key country, particularly up in the north, where you come from. That's where our vaccination rates are still very low, below 30%, whereas other places, many African countries have a higher vaccination rate than the United States. Tanzania and Rwanda are two exemplars of that.
Masai, what's it like dealing with a lot of the governments? If you look at, private-public partnership, what does Africa need today?
Well, I think, a lot of government people here, and we've met with a lot of them. Sometimes we all come out and say, we can't keep giving the excuses of they are not doing it, they are not being cooperative, we have to work together. And they have to be creative. Yeah, they have to be flexible. And I think there are people, a few of these presidents are now setting that tone, to bring in private investors in. and to make sure we see that community is very, very important in how we build. There's a lot of youth that we work with. There's a lot of people in the diaspora that are coming back and want to work in these countries. They are established, they know businesses, and we have to understand that sometimes when you go to Africa, or a lot of times when you go to Africa, we have to work with the key people. Yeah, the key leaders that are going to actually, he mentioned one of them, Aliko Dangote, who's a good friend of ours, and yeah, we have to open up these doors. They have to be open in their minds how they look at how we're developing these countries, especially through the youth. Yeah, because 1 out of every 4 persons is going to be from Africa in how many years from now? The median age is 20 years old. Yeah, how are we not looking at that very critically? And what is being done in health and mental wellness and all those things are going to be very, very key, but also investment and working with governments is going to be very key for us. And they have to open their eyes to this because funds have been taken away now. What are we going to do? Yes, are we going to cry about it, or are we going to build our own nations? And we need visionaries here.
And Bill, I mean, it's the human capital in Africa, actually, which is pretty extraordinary. Is that what makes you most excited?
Yeah, well, that's what hangs in the balance. When things go well, when your population is healthy, then they can do well in school, then the economy grows. And we have many cases in Asia where that, led to fantastic middle-income countries, completely self-sufficient. And absolutely, that's what we want for Africa. Right now, people are turning away from that, whether it's military spending or other things. In meetings like we have here around the General Assembly, the idea of, are we helping those most in need? Historically, it's been okay as we're all getting richer. Are we at least willing to give that 1%? So, incredible promise, but some things like childhood death, including from malaria, the amount of malnutrition, those things are going to go the wrong way until we get some of that basic 1% support back in place.
And Masai, I mean, this must also be discussed in your meetings, right?
Pardon me?
That must also be discussed in your meetings with either private companies or some of the leadership of the countries.
I think we have to set the stage. I think what the MBA is doing in investing in Africa, building the Basketball Africa League, that opens the eyes, to a lot of people. We have lots of people that want to come and do business on the continent, and the governments have to really be open to it. It comes down to leadership, like Bill knows this, we all know it, that the leadership now needs to really pay attention. They have to be creative now.
Gentlemen, thank you so much for joining us today. Thank you.
Thank you.